Hi, my name is Jamie Leonard. I'm student ID number 3345462, and this is my AVMA task video for veterinary anesthesia and surgical assisting, VTHT 1341-33430. Okay, so I'm going to go over our admission forms here at Mechanicsville Animal Hospital. So at our hospital, we are paper light, which means that we don't have forms for everything. A lot of times when we get a new patient, we'll go ahead and just take most of their information over the phone. And then as soon as they come in for their first appointment, instead of having them fill out a handwritten sheet for us, we just go ahead and print all of the information that we have, and then we have them confirm that that's either correct or fix it if it's not, and then they sign the bottom. So here we go, I have an example of one. I went ahead and blocked out all the pertinent information, but we get the client's, can you keep it the other way? Sorry. We've got the client's first and last name, their address, their phone numbers, email address to keep on file, and any pets that they might have, how they heard about us, and then this is saying that, we expect payment at the time of service, and then that we want all animals vaccinated when they're here with us. So we had the owner go ahead and sign that and date that when they came in. And then our permanent patient records. So I'll go ahead and log in our computer. So that's all. We don't have any file charts. Everything we keep on the computer. And so every client has their own account, and they can have all their different pets underneath of the account. And so this client, we've got their information up here. It's got their last name, their first name, address, and phone number, and then we have the individual pet. So this is Ashes, and he is a neutered male domestic short-haired cat. Over here, and he is, 4 years old. Over here we have all of their reminders, so when everything is coming up due. So it looks like he's coming up due for his next leukemia vaccine a little bit later on next month. And then down here below, this is kind of like their chart where we have everything that they've ever done at our hospital. You can kind of scroll through. He's he's only had one visit with us so far, so that's all we have for him. But we also keep record of previous history. So in our computer, we go ahead and click on that and open that up. And this is just kind of where he's been at his previous vet. So we can look up and see he's had his rabies vaccine. There's his rabies certificate. We can scroll down and see if they have any notes from previous doctor visits. And that we also would know what vet to contact if we did need a little bit more information from them. So that's our patient record. It's all on the computer. Let's see. And then for surgery patients, we have them fill out a surgery consent form. So we have two different consent forms. One is just a general surgery form. The other one is our dental form. They're just a little bit different. And this is for a pet named Lolly, and she was here for a dental. So I had her fill out her owner fill out the dental form. So here we go. We've got the date of the procedure, the pet's name, and the owner's name, which I blocked out, and their phone number. Right here, this little portion is saying we either do or do not have permission to extract any teeth. We do our best to contact the owners before we do any extractions. However, in the event that they don't answer their phone or something happens, they can't get to it, do we have permission to go ahead and proceed with any recommended extractions? This owner selected that yes, they do. This next one down, that just gives us permission to anesthetize the pet, whether or not we are allowed to go ahead and perform this procedure. Our next one down is our pre-anesthetic blood work. So at our hospital, we offer a Chem 10 as well as the CBC as our pre-anesthetic blood work. And I'd let the owners know that that's to kind of help promote, or that's going to help make sure that the pet is healthy enough to withstand anesthesia the day of the procedure, make sure everything is working as it should. Our next option down is to place an IV catheter. I let our clients know that that is great to have because we can have them on fluids before, during, and after the procedure to help keep up that organ function. It's also nice to have an IV catheter in place just in case of any sort of emergency. We do have immediate access to that vein. Our next option is a microchip. A lot of times we like to microchip while they are under anesthesia just because it is a rather large needle, so it's nicer if we can do it while they're asleep rather than during a regular wellness visit. The next option down, which is why the form is a little bit different, is because of the dental radiographs. The client can choose to either approve or deny dental radiographs. I let them know it's just like when we go to the dentist, we take full mouth radiographs to get under that gum line and kind of see to make sure everything looks healthy under there. It's also good to have dental radiographs if we expect, if we think that there might be some extractions that might be needed. That way we can see what's going on there. At the bottom it says, did your pet eat this morning? Definitely need to know about that, if there's any chance of aspiration. And is your pet on any medications? If so, when was it given? This client said that they are on medications, but it was just Interceptor Plus and NexGard, which were given about 2 weeks prior, so that's not any worry for our procedure. Let's see. After we go over everything that they might want to do for their procedure, we'll go ahead and give them an estimate to make sure they kind of know exactly what's going on. So here on the estimate, it's pretty much the same thing. We've got our blood work panels, we've got our pre-surgical sedation, which we actually don't charge for. We've got our surgical IV cath and fluids, the actual dental teeth cleaning, dental radiographs. We went ahead and put in a premolar extraction on this one because we know that the pet is going to need one. However, we don't know if there are going to be additional extractions or not. The radiographs might tell us that. And then does not include any injectable medications that might be needed, and doesn't include meds to go home. And then we've got our hazardous waste disposal fee to help us just get rid of all of our needles, syringes, hazardous products that we might have. So we go over that with the owner, and this is a price range because the things for the asterisks are optional, and they may or may not choose to do those. So that's their price range that they sign and agree to. Next, we have our cage cards and other form of identification. So here we make sure that all canines do have ID collars. We have our hospital name, our hospital phone number, and the pet's name on there. We make sure everybody has one around their neck every visit. That way we're sure not to grab the wrong patient. We put them on their neck as soon as they get here. We also have cage cards that the receptionists make for us with their the client's information, the pet's information, what they're here for, the doctor they're seeing, the date, and then whoever brings them back will weigh them and put their weight on the cage card, as well as make sure that's uploaded into the computer. Next, we're going to do a lab form. So our lab forms are all, we make them electronically. So I'll go ahead and pull it up on the computer here. Can you see the screen? Mm-hmm. Okay, cool. So
come a little closer to you.
We'll go ahead and we'll do an IDEX. We'll do a standard biopsy. We'll send that out. And what would you do? You would pop this up. You want to create a requisition. And we're going to order our specimen details. And this is, I'm just doing a mock one, but we'll say you select your sample type, and it would say subcutaneous. And we'll say it was an incisional. And we'll say it was excisional. And they're going to click where it was. So we'll say it's right there in that armpit. And they're just going to give a little bit of a history, and I'm just making this up. But we're going to say growth. Up here, we'll say a 2-inch growth. 1 month ago, rapidly growing over. The computer's going a little slow. So rapidly growing over the last 2 days. And so we'll go ahead and hit done. And then we'll hit order. And that is going to create this requisition, which is our lab form, which we would print out and send with our sample to the laboratory. So it's got our pet's information, their signalment. It's got the type of test you're going to run, where it came from on the body. It's got a little sample of it. And then it's got my little clinical history that I wrote at the bottom. And so that's how you make a lab form. The next thing that we're going to go over, and right here is our anesthesia monitoring log. So this is how long it took to go through Lally's dental. We started at 8:45 in the morning, and we wrote down our measurements every 10 minutes because it was a little bit of a longer procedure. Ended at 10:25 in the morning. So we checked her, we made sure she was on lactated ringer fluids at her fluid rate. We checked her heart rate, her temperature, respiratory rate, her mucous membranes and capillary response time, her blood pressure, her SpO2, her ISO percent, her O2 flow, and we made sure she was on thermal support. And it looks like throughout this entire procedure, she stayed pretty within her normal, her expected range, which is great. Nothing really dropped out of the ordinary. Let's see, we marked the time she was extubated and the size tube that we had used, any suture that was used. We made notes of all of the extractions that we had. And then we also took her temperature post-operatively to make sure that, as well as her heart rate, respiratory rate, we took note of that the entire time until she was waking up, so everything was in a nice and normal range. So that is our anesthesia monitoring log. And then finally we have our discharge instructions. And so this is a copy of our discharge. We have a little note from our surgery technician, and then the patient's information. So we've got the name, the date of the procedure, what we did, and who was helping out with that. So usually when I go over this with the client in the room, I'll start right here with the food and water, and I'll let them know that we want to offer about half of a normal meal we would normally offer for dinner tonight. If they tolerate that well, you can go ahead and do a normal size meal tomorrow morning for breakfast. Same thing with water, just offer a small amount of water as long as they tolerate that well. You can go again normal for breakfast. For this pet, we're going to continue with their normal diet. No need to change anything up for now. However, they might want to soften the kibble with warm water for the next 7 days, just because we did have those extractions. For this pet, the exercise, we can resume normal activity in 1 day. We're going to resume that tomorrow, just because it might be a little bit loopy from the anesthesia. We do want to receive the pet back in 7 days, so just to make sure that everything is healing well, where we had those extractions. No e-collar is needed at this time, and we are sending the pet home with carprofen. So this is our pain management, and we're going to give half a tablet twice a day with food, and we're going to make sure that they know to start that tomorrow morning. They've already had enough injections to get them through the night. We do tell the client to make sure they let us know if they notice anything out of the ordinary. So if their pet is refusing to eat, having vomiting or diarrhea, if they notice a little bit of pink tinge blood in the water bowl, generally that's okay. If they notice any frank blood coming from that mouth, we definitely want them to let us know about that. We also let for patients who had any sort of like incision, we want to make sure they check that daily. We want to make sure they're looking for any bleeding, discharge, swelling at the incision site. And so this is our surgery discharge sheets, and you would adjust this accordingly to the different types of procedure that they had. So I'm going to demonstrate how to restrain for our blood draws. So for a jugular blood draw, I'm just going to have her sit down, and I'm going to go ahead, I'm going to lift her bandana up so that it's not blocking the jugular, and I'm going to hold it still with my fingers and lift her head up, and that's going to give the person pulling the blood easy access to her jugular vein. So I'll go ahead and hold her just like this. For cephalic blood draw, I'm going to go ahead and restrain her head, and then I'm going to go ahead, the person drawing the blood would be holding her foot out like this. I'm going to take my thumb and put it in the crook of that elbow, put some pressure and roll out. And so I'd be restraining just like this, and that's going to make that cephalic vein pop right there. And then for a lateral saphenous vein, I'm going to go ahead and have her lay down. Would you help me put her on her side real quick? And then I'll take her from there.
Sorry.
I'll just lay her on her side. Right, and I'll take her. Thank you. I'm going to use my front arm to hold my arm on her neck and her bottom leg so she can't get up. And if you look at it, I'm going to go ahead and hold off at her stifle and occlude the vein, and that should help the vein to pop right down here. And so that's how you restrain for our 3 canine blood draws. All right, so our 3 restraint holds for a cat. We're going to go ahead and hold for a, Jessie, really quick, can I borrow you? We just hold her leg out for a, right in front of me, cephalic vein. She's going to hold the leg. I'm going to go ahead and just put my thumb in the crick of her elbow, roll out, and that's going to show that cephalic vein right there. Thank you, perfect. And then if you'll come over here, and then for a lateral saphenous, I'm going to scrub her and put her on her side. And Jessie's going to hold that bottom leg out. I'm going to go ahead and put my arm in the crick of her leg back here while holding her tail and her leg and putting pressure down. And that's going to create her saphenous vein right there. And then the final hold is for our jugular. And you can go ahead and let them sit up and just extend their neck up like that, which should expose their jugular right there. If your cat is being swatty, being a little bit more difficult, you can go ahead and pull them over the edge, extend their legs, and stretch them just like that. So those are your restraint holds for cat. Okay, so I'm going to demonstrate how to take a dog out of a cage. So we don't have any smaller dogs here today, so I'm going to take a dog out of a run. And when I open the cage, I'm going to make sure I use my body to block it. That way she can't push past me. I'm going to go ahead and lift up the cage door. I'm going to slide, you can come this way a little bit. I'm going to take my slip lead right here and slide it over her head. Make sure that's nice and snug around her. I can lead her on out this way. There we go. And then to put her back in the cage, I'm going to walk her back in. Come on, Pepper. Guide her into the cage, use my body to block it. I'm going to go ahead and slide that slip lead off and then make sure that cage is nice and snug. All right, so I'm going to go ahead and demonstrate how to take this kitty cat out of the cage. Okay, and she's a large kitty, so I'm just going to take her litter box out just to kind of get it out of the way. All right, hi, kitty. Letting her sniff me. There we go. Hi, baby. I'm going to turn her around backwards. Go ahead and remove her from the cage. I'm going to hold her body nice and close to me and keep my hand on her scruff. That way I have 2 hands on her at all times, so you can move her wherever I need to take her. And then to put her back in, I'm going to make sure that I keep my body in front of the cage door and put her back in her cage, set her in gently, keeping the cage door blocked so she can't leave. Put her litter box back in there. And go ahead and make sure I carefully close the cage door so she can't escape. And that's how you take a cat out and put it back in a cage. We're going to go ahead and apply a muzzle so we can let her sit back up. Good girl, baby. What you're going to do is you're going to have an appropriately sized muzzle. And you're going to go ahead and quickly, yet gently, go ahead and come from behind and slide that muzzle, pretty girl, over the snout. Where are you going? And just shimmy that on there. You're going to pull it behind the ears. Make sure the ears are not tucked in. Make sure it's clasped, nice and snug. And you want to make sure that she has enough room to breathe and pant, but not enough room to bite. And so that's how you place a muzzle on a dog. The next thing we're going to do is we're going to place an e-collar. And so here we go. I'm going to go ahead and just slide that over her head. Bring it around and buckle it in the back. Make sure I get her ears out of it. And you want to make sure that it's not too tight, not too loose. A general rule of thumb is if you can fit 2 fingers around the neck, then you're doing pretty good. And you want to make sure that it does not pull over her head. And so that's placing an Elizabethan collar on a dog. You also want to make sure that her snout does not come beyond the end of the cone. That way she can't chew at anything that we're trying to block her from. There's our Elizabethan collar. Next on our list, let's see, our physical exam. So I'm going to go ahead and do a TPR on Buffy here. So I've got my thermometer right here. It already has some lubricant on it. So I'm going to go ahead and take her temperature. I'm going to take it rectally. It's all right, pretty girl.
I'm a porter up front,
Good job. And sometimes if your dog isn't as cooperative as Bucky here, you'll probably need somebody to help you restrain. 99.9, perfect for a puppy. Let's see, next we're going to go ahead and do our pulse and respiration. So I'm going to go ahead and listen to her heart. So that's going to be about 84-ish beats per minute. Heart sounds nice and clear, nice and even beats. I'm going to go ahead and count her respirations. Just being a little snippy. Hold on, baby. I'm going to hold her mouth shut. Okay, baby.
Here we are.
So about 40 breaths per minute. And then last thing I'm going to do is I'm going to go ahead and listen to her lungs and make sure they sound nice and clear. Okay. That sounds pretty good. So Buffy here, she seems really healthy. Her lungs sound great. Her heart sounds great. She's got a pretty good body condition, so I would go ahead and give her an ASA score of 1. So I'm going to demonstrate how to perform a physical exam on a cat. So the first thing I'm going to do is I'm going to get my TPR. I'm going to save my temperature for a little bit later so we don't stress him out. So I'll get his heart rate first. Make sure that sounds good. Okay, so his heart rate is about 180. Now I'm going to get his respirations. And this guy is asthmatic and he's breathing pretty heavy this morning. Let's try and see what we can count. It's actually about 80, which is pretty high respirations. Like I said, he is breathing kind of hard today. I'm going to go ahead and give his lungs a listen as well. I'm listening for about 2 breaths per quadrant. He's pretty wheezy. Just a little bit of wheeze. It's actually not too terrible this morning. I'm going to go ahead and take his temperature now. I've got it lubricated. I'm going to take it rectally. Hi, buddy. All right, bud. For this guy, I'd probably give him an ASA grade of 2, just because his body condition's pretty good, and his heart sounds good. He just has that little bit of a wheeze there. $99.9 for his temperature. I'll go ahead and make sure I mark all of this down on his chart. So 99.9, pulse is 180, and respirations as 80. So I'm going to go ahead and draw some blood from a canine's cephalic vein. So first I'm going to have my restrainer go ahead and occlude the vein. Go for it. I'll go ahead and spray the vein with some alcohol. Use my thumb to stabilize it. Make sure my belly is up. Insert my needle. Pull back on my syringe. I'm going to go ahead. I have her hold off at the insertion site to prevent a hematoma, and that is how you pull blood from the cephalic vein. I'm going to go ahead and occlude the vein at the thoracic inlet. I'm going to go ahead, feel around for that jugular vein because it's right there. Go ahead and spray it with some alcohol. Get the cap off my needle. Make sure my bevel is up. Insert. And pull back on my syringe. And there is our blood. And I'm going to have my restrainer right there hold off the vein so we don't get a hematoma for about 30 seconds or so. And that is how you draw blood from a jugular vein on a canine. Alright, cool. So I'm going to go ahead and pull some blood from a lateral saphenous vein. So I'm going to go ahead and spray my area with some alcohol. I've got my bevel up. I'm going to insert my needle into the vein. And I just need a couple drops because this is just a heartworm test. Oh, he's whacking me with his tail. There we go. Alright. And so that's how you pull blood from a lateral saphenous vein. So I'm going to pull blood on a cat's cephalic vein. I'm going to spray it with alcohol. Go ahead. Try and stabilize her vein with my thumb. Make sure my bevel is up. Insert my needle. It's okay. Go ahead and pull back. And I just need a little bit because we're just running a blood glucose. So that's how you pull blood on a cephalic vein on a cat. I'm going to go ahead and pull some blood from a cat's jugular vein. Go ahead and raise up the neck. I'm going to open the vein so I can feel it. Right, with a little bit of alcohol. Insert my needle and draw back. That's how you pull blood from a cat's jugular vein. Okay, so I'm going to go ahead and draw some blood from this cat's medial saphenous vein. So Maddie right here is occluding my vein for me. Just spray it with some alcohol. So you can see that vein.
Surgical drop off up front, please. The surgical drop off up front.
All right, kitty. All right, gotta make sure I have my bevel up. It's all right, baby. I'm gonna insert into the vein and draw back on my syringe. Taking little pumps so that I don't collapse the vein. It's all right, baby. All right, if you'll hold that off, Maddie. And that is how you pull blood from a cat's medial saphenous vein. Okay, so now I'm going to discuss the minimum databases that are described in our textbook. So first, you've got your ALT, which is going to check your liver values. You've also got your BUN, which is going to check your kidney values. Your total proteins is going to look for the proteins in the body. Your blood glucose level, which is going to check your sugar levels. And then your PCV, your hematocrit, is going to check for things like anemia. It's going to check for things like dehydration. Here at our hospital, we actually run a full Chem 10 minor panel for our postoperative patients. And so what that is, that's the BUN creatinine, total protein, ALT, alk-phos, calcium, glucose, albumin, globulins. I think that's everything. So we go ahead and we run that on all of our surgery patients. We also ideally would like to run a CBC on all of our patients. However, that is optional. And so if the owners do choose to decline that for whatever reason, whether it's financial or just whatever reason they don't want to do it, then we just we run a manual PCV. That way we make sure we get that checked. If any of these values do come back, make sure you alert your doctor and let them know. Depending on the severity of, how far off they may be, the doctor may choose to go one of a couple of different routes. They might want to reschedule the procedure and check blood work in the future and see if it looks better at that time. They might choose to go ahead and just cancel the procedure altogether. Or they could offer or want to do some additional databases. So some of those additional databases could be anywhere from like x-rays if they're having any sort of vomiting or diarrhea. They could want to check a specific gravity depending on those kidney values. Older patients, you might want to run an ECG just to make sure that their heart is looking okay. And then, of course, maybe run a CBC for anybody who had declined that. So those are some of those additional databases that you might want to take if your pre-anesthetic blood work is a little bit off. Okay, so when choosing your anesthetic and peri-anesthetic protocol with your doctor, here at Mechanicsville Animal Hospital, we pick each protocol for each individual patient. And here at Mechanicsville, we pre-treat everybody. It just depends on the individual as to what they're getting. So usually it's some combination of hydro and acepromazine or hydromidazolam, something similar to that. Obviously, that can change depending on the breed, the individual patient, the doctor. However, that is what we used for our patient Lolly on here. So we had, for her, we went ahead and used hydromorphone 2 mg per mil. We used her dose of 0.1 mg per kg. That's pretty much the dose we use for pretty much everybody. And then we also used acepromazine 10 mg per mil. That has a range of 0.01 to 0.05, and she was a very, very mellow dog, so we went on the low end. We went 0.01 mg per kg, and they were given IM, and then we put the time that they were given. Let's see, for our induction agent, we went ahead and used propofol, and that has a range of 4 to 6 mg per kg, and we went ahead and chose 4 mg per kg for her just because she was getting a pre-medication. And so that was given IV, and it's got the time for that as well as the initials of who gave it. And then finally, we have our pain management, which was carprofen 50 mg per mil. And we give that at a dose of 4.4 mg per kg, and we give that sub-Q. We also sent the pet home with carprofen tablets to last for a week as well. And then just on the bottom of our sheet right here, we have our emergency drugs all calculated out, as well as our monitoring and support. So saying that we use blood pressure, capnograph, body temp, active warming device, dedicated continuous observation, and EKG. Okay, so now I'm going to go ahead and make an entry in our drug log. So here we go. We pulled up some buprenorphine for this kitty cat. So I'm going to go ahead and log it down. Today is 3/30/2020, and it's for our client number 10621. His name is Dash Taylor. And it's from unique bottle number 20-3. And he was a leg amputation. I didn't add anything to it. We use 0.38 mLs. I did not waste any of it. I'm going to go over here and put my doctor's initials so she can come back and initial it on her own. Okay, so this is one of our anesthetic machines. It is a rebreathing machine, and I'll go ahead and start with our oxygen source first. So let's see, this port in the wall right here, we have a hose that connects to it, and it brings us oxygen from a big H tank that we have in another closet on the other side of the hospital. It's chained in an upright position. And so we pull our oxygen from there, it goes through this hose, and it leads us right here to our flow meter. And so it's got this little ball right here, and when you turn on the oxygen, if you can see that, this little ball rises up. When you turn it off, it's gonna fall down. It's also a good idea throughout your procedure to make sure you just keep an eye on that, because if your ball starts to drop, it means you're getting low on oxygen. You definitely want to make sure that you have that tank switched over in a timely manner when it is safe to do so. So that is our flow meter. It is the carrier for your gas anesthetic. So if your oxygen is not on, then your patient is not going to be getting their anesthetic. So over here we have our vaporizer. And right here you can see how much of the anesthetic you have. We're using isoflurane here. And it's got these two little lines. You want to make sure that you have, when you pour your anesthetic in there, that it fits between those two lines. Make sure you have plenty in there. Right here, this little cap, you would twist that off to pour your new anesthesia in there. So the oxygen is going to flow over here, and it's going to vaporize the liquid and turn it into a gas, and that's how it's inhaled. It turns into a gas. Right here we have our little knob for your anesthesia. Oxygen is off right now, but if you were to try to turn this on, you have to push down this little safety knob so that you can turn it, and then you can have anywhere from 0 to 5. You want to make sure that's always off. That way if somebody turns on the oxygen, that doesn't start sending out anesthesia throughout the room. Let's see. So we have our carbon dioxide canister down here. It's hiding behind this. And so our carbon dioxide, that's what, when the patient breathes out, all that carbon dioxide is going to go into this canister, and it's going to turn purple once it's no longer good, once it's full of carbon dioxide. And so we will go ahead and dump it out, get new one in there. Sometimes if it sits for too long, if nobody changes it, the purple will turn back white, so you have to be really careful and really vigilant about making sure it's changed on time. We are a fast-paced hospital here, so we tend to change it around once a week or so, just to be on the safe side. So that is our carbon dioxide, canister. Let's see. We have our pop-off valve right here, and that helps to regulate our pressure. So you go ahead, it's a twist valve. There we go, make sure we keep that. And then we have our pressure manometer. It lets you know how much pressure you have in your tank. It lets you know how much pressure you're using when you give a breath to your patient. You want to make sure that you don't exceed too much pressure so you don't harm your patient. This is your reservoir bag right here. This is a 3-liter bag that's on there. We do have different sizes you can just pop it off and replace it with. And this is how you can help give a breath to your patient. If you need to, go ahead and give them just a manual squeeze right there. You can also use this to help monitor their respiratory rate. You can watch that bag expand and deflate. So these right here are our inhalation and our exhalation valves. And when they breathe, inhale and exhale, you'll see them kind of like flutter up and down, back and forth. And so they're going to breathe in through this tube and out through this tube. And then it's going to take the gas and it's going to come out here through our scavenging system down this blue tube. And it's going to end right here in a disposable F-air canister. We make sure we check those and weigh them every morning before surgery. If there's been a 50 or more gram gain, then it's time to go ahead and dispose of that and get a new one. Let's see. I think, and this is our E-tank. I don't know if you can see that. We have an emergency tank down here. There we go. Okay, so, and then for the end of our tubing, this is what connects to the end of the endotracheal tube so that your patient can get all of their anesthetic and their oxygen. So this is our rebreathing machine, and what that means is that it uses the same air over and over again. So they're going to exhale that carbon dioxide, and then it's going to switch back over to oxygen with the anesthetic. The rebreathing systems are good for medium to larger dogs. And then for smaller dogs, generally good for smaller dogs, like 10 pounds or less, you would use your non-rebreathing system. So I'm going to get this out the way real quick. And this is a non-rebreathing system. And so they are not going to be using the same air over and over again. They're going to be getting new fresh air every single time. And so this is the end right here that is, I'm going to connect to the endotracheal tube. And this is your reservoir bag. Right here is our tubing. We're going to connect it to our fresh gas outlet, and our anesthesia is going to come right through that. And then we have, this is for our scavenging system. This is going to connect right into the F-air canister. So that's how you hook up a non-rebreather. And it's just going to completely bypass the whole rest of that system. So, that is how you use a non-rebreather. Let's see. Other forms you can use for induction, you can use induction masks. We do have 4 different sizes. This one is good for medium to large dogs. This one's good for small cats, or small dogs and cats. And then we also see exotics here occasionally, so we have 2 smaller ones as well. This one's for the really, really teeny tiny guys and the slightly bigger ones. And so what you do for these is you would take this, make sure that your machine is hooked up properly. Just hook that back over here. Go ahead and have a small bag on here just to be safe. And you would hook up the end of your line to your mask, and you would hold that over their snout. So this is a dog's snout. It's going to go in the rubber end. That's going to hold it on still. You're going to turn on your oxygen, your gas. They're going to breathe in that gas. Once the pet is nice and sedate, you're going to go ahead and remove the mask and intubate your pet, and then hook this up to that endotracheal tube. So that is a mask. And then there's also induction chambers, which are these little clear boxes. I don't have one here to show you right now. We have one currently at our other hospital, which kind of transfers back and forth. But it's a clear box. Usually it's made of a thick plastic or glass. And you would put your animal in there. It could be a fractious cat, a feral cat, just a really aggressive small dog, or maybe some sort of exotic.
and you would put it in that box and close your top. And then you're going to go ahead and make sure you hook up your waistline as well as your fresh gas to it, your fresh gas line to it, and go ahead and anesthetize your pet that way. Once they are nice and relaxed, you're going to go ahead and remove them from the induction chamber, and then you're going to go ahead and intubate and get them hooked up to your machine as you normally would. And so that is the anesthetic machine. Now we're going to go ahead and perform a leak test. So what I'm going to do, what I'm going to do is I'm going to go ahead and close the pop-off valve. I'm going to go ahead and plug my thumb on the end of our tubing, and then I'm going to go ahead and fill the O2, the reservoir bag, and you're going to see it fill with oxygen, and it's going to maintain, hopefully, let's turn this on, fill it up, and hopefully it's going to maintain its pressure right there. And as long as it's not leaking, which it's not, then you know that you're good to go. I'm going to loosen my thumb a little bit to let it leak a little bit. And if you see your meter falling, you know you have a leak somewhere, and then you know you need to troubleshoot. And so that is how you perform a leak test on your machine. Alright, so now I'm going to go ahead and hook up all of her leads. So this is our ECG leads. You're going to put your white on the right. We're going to do them right around the armpit area. And then you're going to do the black on the top left. And the red on the bottom left. A good way to remember it is smoke over fire and then white on right. Some machines actually also have a green, and that would go on the bottom right. So I will remember that as grass or clouds over grass. So now you can see it's starting to pick up our electrocardio waves, and so that's reading on our machine right there. This is our pulse ox reader. I'm going to go ahead and place that on her tongue. That's going to give us our O2 saturation. And this little light right here is what's actually going to give us our reading. You want to place it on somewhere that doesn't have a lot of pigment, easier to read, so somewhere like a tongue, an ear. You can even put it on a vulva or prepuce. Next we have our blood pressure cuff. And this is an indirect blood pressure cuff. It's going to go ahead, once it's on, it's going to give us our systolic, diastolic, and our MAP. Our MAP is the main one that we're paying attention to during the surgery. And it's going to give us a reading every 5 minutes or whenever you set it. So let me get this all twisted in here. And then, there we go. All right, we'll get that started. It's going to take a minute for that to read. Here you can see our ECG is running, our SpO2 is at 99. The blood pressure is counting down, so that's going to get started in just a second. Over here is our respirations, and that is counting off of the SpO2 as well as the ECG. And then this right here is our breathe safe, and what that is that chirps every time our patient takes a breath, just like that. And just as a good way to monitor our breathing. Let me see what else I need to discuss. Let's see. And our temperature probe, let's see, here we go. So we have our temperature probe here, and we can go ahead and insert that rectally or orally. I'll go ahead and just do it rectally, put a little bit of lubricant on it. I'm going to slide it down here. So we go ahead and insert that rectally. And that is going to read in that top corner right there once it catches up to par. Right now it's kind of reading just the environment around it. And then one more thing we have to talk about, esophageal stethoscopes. So this is an esophageal stethoscope. And what you're going to do is you're going to lubricate it. And then you would insert that right down in the esophagus. You want to make sure that you don't go in the trachea. Your endotracheal tube is already in there. So first you're going to measure it, and you want to go about from the heart. There we go. From the heart to the end of the mouth, and you kind of like mark it so you know how far to go. And then you're going to slide it down in there until you reach that point. So we know it's about right at that heart. And then the end of your stethoscope, you can take it off, connect it to it, and listen to the heart. It's the most accurate way to listen while they're in surgery. You're right there beside it. And then the last thing that I just wanted to talk about are our gastrointestinal tubes. So we have one of those right here. It's the same thing. You lubricate it, slide it down into that esophagus until you reach the stomach. Again, you're going to measure it about from the stomach to the end of the mouth, so you know exactly how far to put it in. And you can use those to administer barium, to administer activated charcoal. Sometimes you need to feed the pet that way. That's another way that you can do that. So when sizing your endotracheal tube for your patient, you're going to go ahead and measure at their nares. So right between the nostrils, you're going to hold the tube up. And as long as it fits right there, that should be a good size for them. And then to know how far down that you want to go, you want to go ahead and measure at their thoracic inlet. And then you want to go ahead and mark it at their canine, and that's where you're going to go ahead and place your tie. That way you know how far to insert it, make your tie, and then you're going to make sure you inflate your cup. You always want to make sure you grab a size up and a size down from what you think the animal will be, just in case you need to swap it out for another size. And then to check for, he's good to go. And then to check for leaks in your tube, one way you can do it, you go ahead and inflate your cup and submerge it into a cup of water or a bowl of water. And if you see bubbles, you know that there's a leak in your tube. All right, so this is Nikki Ryan, LVT, and she's been my preceptor so far throughout the program. Okay, so I'm going to demonstrate how to place an IV cephalic catheter on a dog. So first thing I'm going to do is I'm going to go ahead and shave a portion of the leg. The clippers are dying a little bit on me. Alright. I'm going to go ahead and scrub the leg. I'm going to do 3 alternating layers of our Chlorhex scrub, an alcohol scrub, and Cammie is rolling off and she's occluding that vein for me. Okay, so I'm going to go ahead and get my catheter ready. Use my thumb to kind of try and stabilize that vein. Make sure I have my bevel up. And she had that little scab on her arm right there. Alright, I got a flash. I'm going to go ahead and advance my catheter. Cammie will grab that for me. I'll put my cap on. Oh, that's okay. No worries. That's alright. I'm going to use my paper towel right here to go ahead and try to get that blood dried up. That way our tape will stick. You can let it pull that. And put my first piece of tape, I've got the sticky side up. Around. Now I've got my sticky, so got the elbow. Okay, I've got my sticky side down this time. I'm going to slide that up. Now I'm going to go ahead and replace that tip with a cap. I'm going to give it a good flush to make sure that it's patent and that the vein is not going to blow. Okay, that feels good. I'm going to go ahead and put my final piece of tape on just to secure it nice in place. And then my final step is I'm going to go ahead and wrap our catheter, and there is a little bit of blood on her fur. However, we can just clean her up while she is recovering from her procedure while we do the rest of her full body cleanup. So that is how you place an IV cephalic catheter on a dog. Okay, so I'm going to go ahead and place a lateral saphenous catheter on this dog. So first thing I'm going to do is I'm going to go ahead and shave a portion of the fur. I'm going to go ahead and scrub. I'm just going to do a dirty scrub first just to get, oh, it's okay, buddy, just to get all that hair off. Okay. I'm going to do alternating layers of that's chlorhexidine scrub and alcohol scrub. I'm going to do it 3 times each. Okay, so I'm going to go ahead, have all my supplies out and ready, and let that kind of air dry for a minute. Okay, that looks pretty dry. Go ahead and stabilize the vein with my thumb. Insert my catheter. Got a flash, I'm going to go ahead and advance. I'm going to go ahead, see if I can get my cap off of there. Grab this one. I got it for now, thank you. Alright, got my cap on there. I'm going to go ahead and place my first layer of tape. I've got my sticky side up. Let that kind of heat fix. On my second piece, I've got my sticky side down. Shimmy that on up. I'm going to go ahead and flush it and make sure that it's patent. Feels good. Didn't blow. Get the cap on there. I'm going to go ahead and put my final piece just to make sure it's nice and secure. And then my final step is I'm going to go ahead and just apply some vet wrap to it. Alright, and that is how you place a lateral saphenous catheter on a dog. Alright, so we're going to go ahead and give a sub-Q injection. This is our carprofen. It's our pain management for our post-op. And so I'm going to go ahead and I'm going to lift up her skin if you look closer. I'm going to kind of like make a little tent right there. Make sure my bevel is up. Insert my needle. Pull back to make sure I don't get any blood in my syringe. And I'm going to go ahead and inject that into her sub-Q space. And so that's how you give a sub-Q injection. Okay, so I'm going to go ahead and demonstrate how to give an intramuscular injection. So I've got Hannah's pre-med right here. And I'm going to give it in her epaxial muscle. We're going to pull up to make sure we don't get any blood. And then we'll go ahead and inject. And that's how you give an intramuscular injection. I'm going to go ahead and give an IV injection. So I'm going to spray the area with alcohol. And I've got Chandler putting the vein for me right there. I'm going to balance the vein with my thumb. Make sure I have my bevel up on my needle. I'm going to go ahead and insert that needle. And make sure I draw back. I've got some blood in my syringe, which is great. So I'm going to have her release. And I'm going to go ahead and slowly inject the vein. And so we're going to hold off that vein for about 30 seconds, and that is how you give an IV injection. Okay, so we're going to go ahead and administer our injection agent. Our doctor wants to use Teolazol, so we're going to go ahead and push that IV. And flush it through, and Teolazol generally acts pretty quickly. And this is our doctor, Dr. Kilgore right here. Alright, I'm going to see if she's loosen up her jaw tone a little bit. I'm going to give her another second or two. I'm going to go ahead. Alright, let's see how we're doing. We're going to check for that peppery roll real quick. I'm going to make sure we have a nice loose jaw tone. I'm going to take, here we go. Alright. I'm going to go ahead and press down on the epiglottis with my laryngoscope. Let's see. Can you hold it slightly higher? Take my endotracheal tube. Right down in there. And go ahead and tie it around her head. Behind her ears. And go ahead and inflate her tube. And I'm going to check and make sure there's no leaking. So I'm going to go ahead and squeeze her lungs. I can hear and feel her breath coming out of there. I'm going to go ahead and get her hooked up to some oxygen and some anesthesia. We are using isoflurane today. And then I'm going to go ahead and lubricate her eyes. So it's a little bit of puff wrinkle, so we'll keep an eye on her. We don't want to get started until that's completely gone. Okay, so I'm going to go ahead and shave for a spay. So I'm going to go ahead and make sure I shave up to that xiphoid process up here. And some good margins on the sides. I'm trying to straighten it out a little bit. There we go. Make sure to get that midline especially really well where the doctor's going to make that incision. Jesse, if you want to grab the vacuum, please, out of surgery.
I did not hear that, but I knew it.
Thank you. Alright, let's get her nice and tidy. Okay, so we're going to vacuum all that hair away. Thank you, ma'am. Alright. Go ahead and try to express her bladder if she has one. Doesn't feel like she has a whole lot in there. We went ahead and tried that. So now we're going to go ahead and do our scrub and then we'll move her into surgery. Okay, so now we're going to go ahead and do our sterile scrub. So I've got my sterile gloves on, and I have some sterile chlorhexidine solution and some sterile gauze. I'm going to go ahead and start at where the midline incision will be. I'm going to go ahead and go in a circular motion. And as soon as my gauze hits any fur, which right now, I'm going to go ahead and abort mission and start over. Let's do an alcohol one. Circular motion, going outwards. I'm going to make sure I do at least 3 rounds of each. And that hit the gauze, so let her hit the fur. I'm going to go for one more time just for good measure after this. Last round of Chlorhex scrub. Starting at that midline incision area. And then ending with our alcohol. And that is how you sterilely prep your incision area. Okay, so our patient has just been scrubbed, so I'm going to go ahead and move us into surgery. So I'm going to be really careful not to allow anything to touch the portion that was just scrubbed. you go. Turn her on in there. On our table, they're back hooked up to her oxygen and her anesthesia. And I'll get her hooked up, please. Alright, I'm gonna get her all hooked in. Alright. And my mask fell off my face while we were doing our scrub out there, so we have our ill-fitting ones right now that somebody had handmade us because we ran out of masks with the COVID pandemic right now. So I'll go grab that in just a minute. I'll straighten it up in just a second. Right, I want to make sure that I don't occlude the vein when we have our catheter. Okay, straighten that. Okay, I'm going to go ahead and do some monitoring. All right, heart rate is holding steady, right around 80. Let's see, we'll go ahead and make sure we mark all this down. I'll come over here. So if you want to come over and look at our pulse ox, we can just look at the sheet. Or I'm sorry, look at our Cardell over there. We're going to go ahead and do our next reading. And we are on LRS fluids, lactated ringers. And our heart rate is hanging around, it's reading 81. I got 81, I counted. Our temperature is 96.6. We do have warmies on our patient. She's also on a heating pad as well. Respiratory rate is 18. You can also hear it just gave us a little chirp on our breathe safe. Our mucous membrane and our capillary response time, we can check that really quick. I'm just going to slide under here. Looks great. So she's pink and with a lesson to CRT. Her blood pressure, let's see, a little bit high, keep an eye on that. SpO2 is reading at 97%, which is okay. Our ISO is currently on 2 with an O2 meter at 1. We are on thermal support. And so that is how you monitor during a procedure. You want to make sure that you're trusting that your machine is your secondary monitor. So me being the technician, I'm going to be the eyes and the ears of this patient, so I'm going to make sure that I'm listening with my stethoscope. I'm paying attention to whether the patient is breathing or not, and that machine is just to back me up, just to agree with what I'm finding. So before starting CPR, you want to confirm that your patient has no pulse or respiration. If it is in fact in arrest, you want to go ahead and start CPR immediately while someone goes to find a doctor as quickly as possible. The average dog will be in lateral recumbency. However, if you have like a barrel-chested dog, such as a bulldog or something wide like that, you will have them up on their back. Excuse me. For smaller dogs, you're going to use your hand to encompass the ventral thorax to do your compressions. And for larger dogs, you're going to go ahead at the widest point of their thorax. You're going to use a two-handed method to go ahead and deliver your compressions that way. Compressions are given between 100 and 120 beats per minute. And then you want to make sure you go about 50% compression, 50% like the width of their body. And then you want to make sure that you are giving 30 compressions, followed by 2 breaths. So we're going to go 1, 2, 3, 4, 5, 6, 7, 8, 9, 11, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27,
30, and once you do your 30 compressions, you want to give your 2 breaths. So if your patient is already intubated, you're gonna go ahead and hook up your ambu bag, and you're gonna give 2 breaths. 1, 2, and then you're gonna continue your compressions again, and then you're gonna give breath and keep going back and forth until the doctor tells you to stop. You also need to swap out with somebody every couple of minutes because you will get very tired very quickly. If you do not have an ambu bag available, or if your patient is not intubated at this moment, you can give manual breaths. You encompass their snout and you give 2 breaths into their nose. You want to also make sure that every time that you are giving your chest compressions, you allow that chest to rise back up between each compression. Let's see, and so that is how you perform CPR on an animal. Okay, so I'm going to demonstrate how to do a proper scrub-in for surgery. So the first thing you're going to do is you're going to remove all jewelry and watches, and then you're going to go ahead and put on your cap and your mask. We are in the middle of our COVID-19 pandemic right now, and we are completely out of our disposable surgery masks. So somebody made these and brought them in for us for surgery. They're a little ill-fitting, so they don't stay on our faces really well. I will do my best to keep it on during our procedure. They don't have anything to hold your nose still. And then we have our cap that we're going to go ahead and put on our head. Make sure your hair is completely covered. And then first thing you're going to do is you're just going to wash your hands with a microbial scrub.
Ma'am? Yeah. Try like this. Look at that,
Alright. Make you wait. You said there and said
Yes, that's what I usually they don't always do it all the way down there. But I don't know what I'm doing. Probably in quick and small. Okay. Alright. And then I'm going to go ahead, I had already cracked open. Turn it down all the way up. Usually so I'm going to go ahead and use my scrub. My nail tips to go ahead and get underneath my nails. Make sure there's no debris under there. Yeah, we usually clean. Okay. And then we're going to start scrubbing. So you've got 4 sides to your fingers, your hands, your arms. And you want to make sure you scrub all 4 of those sides about 10 times each. And you're going to start at the tip of your finger and work your way down. Your fingers are the most sterile part of your hand. You also want to make sure that you keep your hands upright. That way the water drips down towards your elbows. That way you're not recontaminating your hands with any unclean water. Go all the way down to at least your elbow. I'm going to rinse up this arm, and we're going to do the same thing on the opposite hand. going to go ahead and just drop my sponge in the sink. And I'm going to rinse my hands off, my arms off. Again, letting everything run down towards my elbow. Just not contaminate my fingers. Alright, Chandler, if you would do three things for me, if you'll turn off the water, put my mask a little bit more over my nose because it keeps falling, and then bring the camera in here. Thank you. Alright, let's see. That is perfect. Thank you. Alright. So now I'm going to demonstrate how to properly dry your hands. So we have a sterile towel on top of my gown over here. And I want to quickly go ahead and just kind of grab that from the corner so that I don't get any water droplets on that gown that could contaminate that. So I'm going to find my corner, which is right here. Go ahead and lift it up and shake it out. And I'm going to go ahead and dry my hands from the tips of my fingers all the way down. Make sure they're really thoroughly dry. We no longer use gloves with powder in them, and so if your hands aren't completely dry, they're just a pain to get on. So you want to make sure they're really thorough.
Yeah.
I'll tell you right now,
Elbow.
been a little bit.
And make sure I hold it far enough away from me that the towel doesn't touch my clothes or the table or anything around me. I'm going to go ahead and use the opposite end to do my other hand. Again, starting at the tips of my fingers. And my mask is coming down again. I apologize. Alright, so now that I'm done drying, I'm going to go ahead and just drop my towel right there. I'm going to go ahead and open up my gown and slide that on. I'm going to go ahead and pick it up with our strings right here. Don't let it touch any table or anything like that. Go ahead and slide my arms in. Make sure keeping my body towards our sterile area. And I'm just going to have somebody tie me in really quickly. Cassie, would you move to tie me in really quick? Yeah. Thank you.
Look back at her on.
Alright, so now I'm going to go ahead and get my gloves on. Make sure to keep my fingers in my gloves. I'm going to go ahead and open those up. Put that on my hand. I'm try and get that open as best I can.
Sometimes all they need is dead and Marion long term. He's going to dead and Marion every day.
Just kind of shake it out a little bit.
Just call and get him up right now.
There we go.
All right, thanks so
Alright,
much.
so
Yes,
I've
sir.
got that on my hand. And kind of pull my hand around it.
Are you all ready for me?
And even though it looks kind of funny, I've got my fingers in there. So I'm going to go ahead and put my other one on, and then I can fix that. So I'm going to go ahead and slide my fingers underneath. Kind of shimmy it open a little bit. And go ahead and slide my hand into it. Keeping my fingers inside my sleeve still. Alright, so now that I'm completely covered, I'm going to go ahead and pull this up and adjust my fingers.
I remember something about that.
I actually meant to, I'm an idiot.
I was wondering because you always used to, and I was like, no, it's fine.
Thumb is hiding in my sleeve there, trying to get that out. And my pinky as well. those pulled on. This all the way up. Okay. So that's how you do a closed glove. Okay, so now I'm going to go ahead and organize our surgery tray for our doctor. So I'm going to go ahead and pick up our blade right here and get that out of the way. Go ahead. This is one of our extra towels in case the doctor might need it for any reason, so I'm going to make sure I keep that. All right. Here's our drapes that we're going to use to drape over our patient, as well as our clamps that we're going to use to attach the drape. And then here we have 60 sterile gauzes. We make sure that we count them before we put them in every pack. That way we can always count them at the end of the procedure as well. That way we make sure that everything is accounted for, that there's no gauze stuck in any body cavities or anything like that. And so the way that our doctor likes his instruments here, I'm going to go ahead and remove that OK strip. Everything is nice and sterile. And so the way that our doctor likes his instruments is he likes to have all of his curved tip instruments together, laid out nicely where he can see them, and then all of our straight tip instruments together where we can see them. I'm going to go ahead and pull my needle drivers out separately. Lay them out nice and neat so he can see everything that he needs there. Trying not to have them overlap as best you can. That way you can just slide exactly everything he needs out. I'm also going to go ahead and pull out our blade holder so we can put our blade on that. And our forceps and our spay hook. I'm going to go ahead and spread all of these out nicely. Alright. So that looks good. That's about how Dr. Kowalski likes his instruments. I'm going to get these right here. Alright, make sure we have that needle driver nice and easy for him to reach. And then we're going to go ahead and use, now that we did that, we're going to use a pair of forceps. And we're going to go ahead and place our blade on our needle holder for our doctor. I'm going to go ahead and slide it. Slide it on. And so now I have the blade on there for my doctor, and I can hand that to him when he comes in. And that is how you set up a surgery table. All right, so we've got our drape. We're gonna go ahead and drape our cat. We're gonna open it up, ensure that we're not touching anything around us. So first thing I'm gonna do is I'm gonna open it completely, and then I'll fold it in half to go ahead and cut out a portion so that our doctor can make his spay incision. Okay. Now that we've got that, I'm going to go ahead and fold in my corners. I'm going to place that over my patient. And then we use our clamps to clamp it on. Last one. And that is how you drape for a spay.
Okay, Jamie, could you flush this for me?
Sure.
Perfect. And then just give it a dab before we replace it to the abdomen.
Okay.
Perfect. Thank you.
So I'm going to go ahead and put our blade on our scalpel holder. Make sure we use forceps. Like that. Just slide that on. Lock that into place. And so I'll go ahead and hand my blade properly to Dr. Purdue. I'm going to make sure I face it away from her. Thank you. And then we can set that down, and I will hand her a couple other instruments. So to hand her thumb forceps, I'm just going to make sure I have the handle towards her. And then my hinge forceps, I'm going to make sure that the box hinge is undone and hand those directly to her like that. Thank you. Okay.
Okay, so the responsibilities of a sterile technician. So first things first, you want to make sure you have done your aseptic hand wash, and then you want to don yourself in your cap, mask, and ideally booties. You're going to be wearing a sterile gown and sterile gloves. You want to make sure you keep your hands above waist level. You can clasp them like this, or just, keep them up above your waist against your body. Below the waist is, or below like the surgical table as well, is considered sterile. Is considered unsterile, as is the back of your gown, which is why if you turn away from the sterile field and you turn completely backwards, then you're no longer considered sterile. That's a break in sterility. However, if you must move around the surgery room, like if your doctor needs to trade sides with you for whatever reason, you want to make sure that as you guys pass, that you either pass front to front or back to back, so that you guys don't contaminate each other. Let's see, if you were to have a break in your sterility, say you ripped your glove, then you want to go ahead and remove those and then have the circulating nurse help you don a new pair. For an instrument, say you guys drop a surgical instrument, do not pick it up. If you're sterile, just have the circulating nurse go ahead and open you up a new one. If you don't have a new one ready to roll, then the doctor might ask that she flash sterilizes it for you to have it ready to go. And so that is pretty much the duties of the sterile technician. You just want to make sure that you just keep your sterility at all times. Do your best not to contaminate your field. Try not to sneeze in the sterile area or cough in the sterile area. You should have your mask on, but just do your best to maintain that sterility. So we're in here with a canine neuter right now. Dr. Callahan is just about to remove the testicles. So I'm going to go ahead and take our next reading on our pet. Okay, so I'm in with Dr. Purdue right now. We are in a canine spay. So I'm going to go ahead and do some monitoring. Okay, so now we're going and we're prepping for our cat neuter. This is a 6-month-old rag doll. We're going to go ahead and get him neutered today. Dr. Purdue is scrubbing in. She'll be in just a minute. Okay, so I'm in with Dr. Purdue right now. She is currently, she has the horns out of her spay. This is our feline spay procedure. Okay, so we're all done with surgery for the day, so I'm going to go ahead and clean our surgery suite. So I'll just go ahead and get everything out of the way. Got a couple sharps over here, so I'm going to go ahead and make sure they go in the sharps container. We don't have any other hazardous waste right now. No body parts or anything that we need to get rid of. If we did, we would just put those properly in our hazardous waste bins. Another needle. See, there's an endotracheal tube. We'll take that out to get washed. I'm going to go ahead and just look through and make sure there's no blades or anything on our instrument so that nobody gets cut. Alright, it looks like our doctor has already disposed of her blade. She's really good about that. So that's great. I'm going to go ahead and move these extra gauze out the way. Got our OK strap. Alright. I'm going to take our instruments and our endotracheal tube. And I'm just going to set this over here to be cleaned in just a few minutes. Come back in and keep cleaning. Okay, we've got our ECG leads here. Get those wrapped up and wiped with some alcohol. These are alcohol wipes right here.
her down as well.
Well, no, I wonder if she.
Let's stick with the Velcro there. Okay. We'll let those dry for a second. We'll get those wrapped up. And then we're going to go ahead and clean the rest of our table. Our heating pad. Oh, and there's the sharp. That. I'm going to grab a rag really quickly. Alright, a couple cleaning rags, there we go.
She might have heard something here. And not like where she has arthritis.
Table, and this is Rescue that we're using to clean.
Yes, and it's one shirt. But nothing for her. I'm holding it, see.
Here. Go ahead and do this tray over here while I'm at it. Slide that out the way. I'm going to go ahead and wipe off our Cardell and all of our equipment that we used over there. Just in case anybody touched anything.
Yeah.
Two monitor. I'm going to use the alcohol for the monitor.
Yeah. So I put that in.
He literally looks like I'm coming out.
Let me know if I get a little time. Okay. Wrap that up nicely.
I had to catch him midair. Look at that gauge.
We've got our temperature probe.
It's a boss who makes it like a pig, I think. Well, if you're doing it, double it.
Right, and then we have our blood pressure cuff.
Yeah, I want to take an X-ray. I wouldn't mind getting one of the shoulders.
Okay.
Can you come tomorrow?
We're also going to make sure we wipe down our anesthesia machine and our breathing tubes. Get that all hooked up and slid into the corner. All right. We've got a reservoir bag on the floor. Go ahead and hang that up. Use some alcohol. Wipe down our breathing tubes that we may have touched.
For me, it goes on small and sure that her belly is what Mia.
I'm just going to go ahead and remove our brief safe. And we're going to wipe that down as well.
Because
It's probably going to start chirping at us now. We woke it up.
but Mia was like Mia time from last
Okay.
night, but childhood was.
I'm also going to wipe down my vaporizer and my flow meter.
1 minute.
Put in outfit.
But is he's up though, Kenny?
Alright, my handles on everything.
Anya.
Alright, now I'm going to go ahead and clean my counters back here.
She really likes
There's nice and clean. Wrap up my ECG. handles on our lights.
10 seconds.
And then I'm going to sweep and mop our floor as well as... Alright, so we just got to take out our trash and put it in a new bag. Go ahead and move our IV pole over here into this corner as well as our anesthesia machine. Get our anesthesia machine into the corner and our fluids as well. So now the room looks pretty clean. I'm just going to go ahead and sweep right here and mop, and then the surgery room is all clean and ready for tomorrow. Okay, so I'm going to demonstrate how to properly clean our surgery instruments now. So in this bucket here, I've got some diluted enzymatic cleaner that we have right here. It also has a lubricant mixed into it. And so we've got that in there. We're going to go ahead and make sure that we unhinge all of our instruments. That way they can be properly penetrated. We're going to stick them in here. We're going to make sure that we don't double stack the instruments as best we can. With all these in here, we're going to go ahead and let them soak for about 10 minutes.
Can you squeeze that back, Shannon?
In the enzymatic cleaner. You want to make sure that you have enough cleaner in your bucket or in your sink, whatever you're using, that it covers the instruments completely.
Without taking her off.
I've got all these soaking. You can see that soaking in our bucket here. We're going to leave that for about 10 minutes. Okay, so our instruments have been soaking in the enzymatic cleaner with the lubricant in there. So now we're going to go ahead and scrub and rinse those.
Oh, you got a tick in your paw.
Right, and I'm going to make sure that we scrub the box hinges really well. And definitely on any of these serrated edges on all of our instruments. Thoroughly clean. You want to get any debris, any blood out of our instruments. You also want to make sure you get the handles really well. In case the doctor had any blood on their gloves that would have gotten on there. You just want to get the whole instrument
Okay.
nice and
So I guess I shouldn't pull that off, huh? No, I couldn't. I tried. Mike.
It's pretty good. So I'm going to rinse it off. And then I'm going to go ahead and put that in my ultrasonic cleaner. So that's going to go ahead and shake any excess debris out that might not have come out with my scrubbing. I'm just going to make sure that they're extra clean.
Yeah, he wanted to, he was like, you know what, dental on your chin? I'm like, oh, I can't do that. He goes, does he need a little?
I mean, I could get
No,
her
did.
now.
Yeah, if you want to, yeah, if you want to do that, go ahead. Okay, now that we have all of our instruments cleaned and scrubbed, we're going to go ahead and shake them in our ultrasonic cleaner. So I'm going to put the lid back on. I'm going to go ahead and set our timer for 10 minutes. Okay, so our ultrasonic cleaner has finished its cycle, so we're going to go ahead and take all of our instruments out of there. We're gonna go ahead and rinse them off. There we go. In our sink real quick. Just thoroughly rinse. Okay. We're gonna go ahead and lay them out so they can air dry. So I'm gonna go ahead, lift our towel up here. I'm gonna go ahead and get all our instruments out. We'll get them all set up. Okay. I'm gonna go ahead and get these all organized. So I've got all my curve tips here first. Go ahead and put them down from smallest to largest.
They're very serious.
Oh, I do have those.
All of our straight tipped instruments.
I wear them when I wear my contact.
We've got our forceps and our spay hook and our blade holder, our scalpel holder, and then our clamps.
Oh, you being nasty to Chandler too?
Right, so now I'm going to go ahead, cover them up with a towel, that way they stay nice and clean while they are drying. And then we have a little sign that we put just so nobody accidentally picks up our towel and the instruments go flying. So the instruments are drying under towel, and that is how you dry your instruments. Okay, so now I'm going to go ahead and wrap our pack. So I've got our cloth drape right here. Go ahead and put that on our tray. And then we like to have, just at our hospital, just something to keep it nice and sturdy on the bottom, so it's not bouncing and being all flimsy. And first thing we're going to put down is our OK strip, just to make sure that everything gets nice and sterile. So I'm going to go ahead and get our instruments set up and ready to roll. Perfect. Let's see.
17 times 4 is 28 plus 40 is 68. Can you bring that dog over here, Chandler? I think this dog is in rough shape. I don't know why. Can you hold that? It doesn't like that. You can just blow this down
Then
there.
we're going to go ahead and stick our gauze on top. And then we like to put our clamps on underneath. Everything is still unhinged. And then we're going to cover it with a drape, or we actually have two drapes. What's her name? Because that's going to be the first thing the doctor's going to use when they open the pack. They're going to take their drape off to drape their patient, and then they're going to go ahead and clamp it to the patient.
Yes. Yes.
So now we're going to go ahead and wrap our pack. We want it to be as snug as possible. We're going to pull it back. That way we should have kind of something to pull up when we open the pack. Pull my sides in. Straighten this out. Pull it back, tuck it in, kind of like an envelope. Tucked sure that we stick, leave it one fold a little bit nicer. There we go, a hand towel in between our layers of drape. That way the doctor can use it to dry their hands after they are sterile. And center that back on. And then do our outer layer of the wrap. Okay, pull that nice and snug.
Trying to pull this side out, like, can't break it all. I was like, that's a little bad. It was crazy. I was like, I'll tell that thing. Every time I bring up crap, it's so crazy.
Right.
So we had to let it do it. So it's not like a heart rate of 60 temperature.
Over. All right, now we're going to go ahead and tape it shut. So we moved it here.
Blood work, dude.
I like to
It's
put little
running.
tabs on it.
It's
That
running.
way it's just easier to get it off.
Only two.
Stick that right on there. And use our Sharpie. There we go. To label the date that it was sterilized, which pack it is, and the initials of the person who got it together. So this is our blue pack. Today is Earth. And my initials. So that is how you wrap a surgery pack. Okay, so I'm going to demonstrate how to fold and wrap a surgery gown. So first thing you want to do is you want to make sure that your clean gown is not inside out. And then you're going to lay it out on your prep table.
Miss Downey is on line 2, checking on rider. Miss Downey is on line 2, checking on
Put
rider.
your sleeves up. You're going to lay that across the body. Same with your other sleeve. Down across the body.
Miss Downey?
Then you're going to go ahead and take your side and fold that in half. It's going to leave an opening right there for the sleeve for the doctor to slide their arms in. Same thing on the other side. Do one more fold over on the side.
Yeah, so I would say if you haven't heard from us by one time tomorrow, go ahead and give us a call. They're a little crazy.
That's over here.
Yeah, I think you're doing fine.
Okay, and now we're going to go ahead and accordion style fold our gown. Backwards.
No, so we just want to make sure that the other well and stuff is right.
Once you have your gown folded, you're going to go ahead and wrap it. So I've got our cloth drapes over here.
All right, sounds good. Yes, ma'am. Bye-bye.
Set that on there, as well as our OK strip to make sure everything that sterilizes properly. I'm just going to slide that right on the top and you can see it. And we're going to wrap our gown. I'm leaving little pull tabs, that way we have those to open it. We're going to tuck it in here. Now I'm going to go ahead and stick, we like to put our hand towels on top of the first layer. That way when the technician opens the pack for the doctor, they have it open and there's a sterile towel right there for the doctor to dry their hands off with before they use their gown. Once you have your gown wrapped, you're going to go ahead and label it with your tape. So I'm going to go grab some of that. Okay, so I've got my Sarah tape right here. The stripes will turn black once it is sterile. Go ahead and take my Sharpie and label the size gown. So this is a large surgery gown. Today's date. And my initials. Get that autoclaved. So that is how you wrap a surgery gown.
Okay, so this is our autoclave, and it works by you put distilled water in there, and it builds up pressure and it creates steam, and it's going to go ahead and penetrate all of your instruments or whatever you have sterilizing in your machine. So right now I currently have 2 packs in here that we're about to start. You want to make sure that your packs are not touching the sides, top to bottom. And you don't want them up on each other. You don't want anything stacked on each other that could stop them from being properly sterilized. When you're running your autoclave, you want to make sure that your PSI is between 17 and 25. Your temperature is between 250 and 250 and 270 degrees. And then generally your machine is going to run for about 30 minutes. So I want to make sure we have enough distilled water in our reservoir tank. We could use a little bit more. There we go. And I've got my 2 packs in there. What I'm going to do is I'm going to go ahead and turn on our machine. And I'm going to go ahead and turn it to fill water. And we're going to watch the water come down. And once it hits this little divot right here, we're going to go ahead and lock the door. Sometimes it's a little bit slow. Here it comes. Alright. Now that our water's here, it's in the divot. Go ahead and lock it. Alright, now that that's nice and tight, I'm going to go ahead and move the nozzle over to sterilize. And let's set it for 30 minutes, and we have our temperature set at 270 degrees. So we're going to let that run. As soon as it hits, we're going to go ahead and change it over. Autoclave just finished sterilizing, so now I'm going to go ahead and move it to dry. We'll set the timer for that, and then we'll come back and exhaust it. Okay, so our timer on our dryer just went off, so now I'm going to go ahead and turn our settings back to 0. I'm going to turn everything off, and now I'm going to go ahead and crack open the door to kind of let it exhaust the air out a little bit, and that's going to prevent condensation from building up on our pack. It makes sure that no moisture gets and stays in there. You can kind of see the steam coming out. And then we're going to make sure that we don't take those instruments or those packs out until everything, so that everything is nice and dry. That way we don't contaminate our sterile packs. Autoclave maintenance. So we clean our autoclave once weekly just because we are a high volume clinic. So we use this Omni cleaner, and what you do is you're going to pour some into our reservoir tank right here with your distilled water, and then you're going to go ahead and run a cycle, and you're going to go ahead and drain all of the water out of the autoclave, and then you're going to do the same thing again, drain it, and then you're going to open it up. You're going to wipe out the inside with a clean rag, just to get any residue that might be left inside of there, and then you make sure you replace your reservoir tank with some nice fresh distilled water when you're complete. To ensure that your surgery pack is sterile, you're going to check 2 things. The first is going to be your indicator tape. So it's going to start out as this white tape with these little white stripes on it. And once your pack has been sterilized, it's going to turn to this black or dark brown kind of color. And once that's happened, you know it's sterile. Also, once you open your pack, I've got a no longer sterile pack here. It's was just used in surgery, but it has this little OK strip right in here, and that has turned a black color as well. So, and it's nice and even, so you know that the pack sterilized properly. Before you sterilize it, it's this clear, the white color on that OK strip. So that is how you know that your pack has been properly sterilized.
Okay, so we're going to go ahead and remove some sutures on smudge here. So you know that the sutures are ready to come out as long as everything is healed nicely. If you do notice any reddening, swelling, discharge at your incision site, you want to make sure you alert your doctor. I already let Dr. Brooke look at this, and she saw that little wound right there, and she's okay with us taking the sutures out. So we're going to go ahead and proceed. So here we are. I'm going to go ahead and grab the tail of the suture with my hemostats. I'm going to go ahead and slide the curved tip of my suture scissors underneath that little loop. And clip that out. I'm just going to do that all the way through. It's okay, buddy. These are, there we go. It's okay, buddy. We're almost done. I think our scissors are a little dull. There we go. It's okay, friend. It's okay. You're doing so good. It's alright, buddy. 2 more. We're almost there. Well, 3 more, I lied to you. Hold on. Almost there. It's okay, Smudge. You're doing great. Grab this tail right here. Alright, 1 more, friend. Alright, and so that is how you remove sutures.